Hello, my name is Jeremy. I'm going to be the nurse practitioner assessing today. I'm just going to go ahead and clean my hands. All right, can you confirm your name and date of birth for me?
Becca L'Oreal, April 6, 1998.
Okay, and what are you coming in for today, Becca?
A routine physical.
Okay, we can do that. Can you go ahead and tell me today's date?
April 14th, 2025.
Okay, and can you tell me what city we're in?
Austin, Texas.
Alrighty, and what kind of building is this?
Is a clinic.
Okay, so Becca is alert and oriented ×4. On general appearance, she has her hygiene intact. She's appropriately groomed. She doesn't appear to be any sign of distress. And so Becca, we're gonna go ahead and do a head-to-toe assessment on you. And throughout the assessment, we're gonna assess your skin. We're gonna look for temperature, texture. We're gonna assess for any obvious wounds, lesions, and we're also going to assess to see if there's any suspicious moles. If there are, we're going to use the ABCDE criteria, and if we need to, we'll refer you to a dermatologist if we see anything like that. So before we begin the head-to-toe assessment, we're going to get a quick set of vital signs on you, and that's going to include your height and weight as well. And have you been having any pain lately?
No.
Okay, good. In the last week or so?
No.
Okay, awesome. So we're going to go ahead and start with the head. So we're going to just look at the symmetry. The head looks symmetrical. I don't see any obvious masses or deformities. Inspecting the scalp, I don't see any redness, swelling. The scalp doesn't look overly dry. Hair is equally distributed. Okay, I'm going to go ahead and palpate. Do you feel any tenderness in your scalp anywhere?
No.
Okay. No masses were felt. Everything seems symmetrical on palpation as well. Now we're going to go ahead and do a visual inspection of your face. Face is symmetrical. I don't see any obvious deformities. No skin issues either. And we're going to go ahead and we're going to palpate your TMJ. So let me go ahead and do that. Go ahead and open wide for me, and now close. Did you feel any clicking? Okay, I didn't either. So now we're going to go ahead and move on to the sensation on your face. So I'm going to go ahead and have you close your eyes for me, and I'm going to use an instrument. You tell me if you feel it's dull or sharp.
Dull, 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 dull.
Okay, now again.
Sharp, 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 sharp.
Okay, so good sensation on the face. Her Becca's cranial nerve 5 is intact. Now we're going to go ahead and Becca, go ahead and raise your eyebrows up. Okay, close them really tight. Good, and then smile for me. All right, and then puff out your cheeks. Okay, so good motor reflex in her face as well. So cranial nerve 8 is intact. Now we're going to go ahead and palpate your sinuses. I'm going to do the frontal. It's right underneath your eyebrows. Do you have any tenderness here?
No.
Okay, and I'm going to go ahead and palpate the maxillary. Do you have any tenderness here?
No.
Okay, so sinuses are good. We're going to move on to the nose. On visual inspection, it's symmetrical. I don't see any obvious deformities or deviations. Skin looks good too. No redness or erythema or anything. I'm going to take a look inside your nose with the otoscope. So I'm looking inside the nose, and let me lift this up. Okay, looking inside the nose, nasal mucosa is pink, turbinates are moist, a little bit of scant drainage, no occlusions, good patency. Okay, let's look on the other side. No erythema either. Okay, nasal mucosa is pink, no obstructions, no erythema, turbinates are moist, and yeah, looks good in there too. Alright, so now we're going to go ahead and move on to the eyes. So I'm going to go ahead and visually inspect the external structures of your eyes. I don't see any nodules nodules on your eyelids. Your eyelashes are equally distributed. I don't see any drainage. Sclera is white. Conjunctiva is pink. And then go ahead and look up for me. Look side to side. Okay, yeah. I can see the conjunctiva, it's still pink. And now we're gonna go ahead and look at the pupils. So I'm gonna use my pen light. Now look right at the tip of my nose, and I'm just gonna test your reflexes, okay? Okay, good. All right. Becca's pupils are equal, round, and reactive to light. They're about a 4 bilaterally, and good accommodation. So now we're gonna look at, so her cranial nerve 3 is intact. Now we're gonna do extraocular movements. So go ahead and just follow the pen light with just your eyes without moving your head. Okay. Okay, so I did the 6 cardinal signs. I didn't see any kind of nystagmus and no abnormalities there. So her extraocular movement is intact. Cranial nerve 3, 4, and 6 are intact. Now I'm going to do a visual acuity test. So go ahead and hold this out for me, and then cover your right eye, and then read the smallest line you can.
LTFPH.
Okay, now let's go ahead and switch hands and cover the other eye.
LTFPH.
Okay, perfect. It's good 20/20 vision. Okay, now with that, we're going to move on to the ears. So on inspection of the ears, looking at the pinna and the tragus, they seem to be normal. I don't see any swelling, erythema, no drainage, and I'm going to palpate the mastoid process. Okay, any tenderness?
No.
Okay, other side, the pinna and the tragus look good, no erythema, no swelling, and no drainage noted. I'm going to palpate the mastoid here as well. Any tenderness?
No.
Okay, cool. So now we're going to look inside your ears. I'm going to get a clean scope. Okay. Now looking inside. All right, your canal is patent. I can see the tympanic membrane. It's pearly gray. Bony structures are present. A little bit of earwax that's expected. And yeah, looks good. So I'm gonna look at the other side. Okay, ear canal is clear. I don't see any occlusions, a little bit of earwax. Tympanic membrane is pearly gray, and bony prominences are present. Okay, looks good. One thing I did forget to do was look at your eye for the red light reflex. So I'm just gonna go back to that really quick. Okay, now just look over my shoulder, and I'm gonna look in here. Okay. Red reflex is present. Optic disc is present as well. It is orange and yellowish in color. Vessels are present. It's the retina. It's intact. No signs of hemorrhages. Cup to disc ratio is about a 1 to 3. I'm looking at the other side. And one thing I forgot. Look directly at the light. Okay, macula is present as well. So we go to this side. Okay. So red light reflex is present. Optic disc is present as well. Orange and yellowish in color. I can see the retina. Good vessels, no hemorrhages. And cup to disc ratio is about a 1 to 3 here as well. Go ahead and look directly in the light. Okay. Macula is present as well. Cool. So that looks good. Okay. Now going back to the ears, we already looked inside. Now we're going to do a smellings test, and by doing the ophthalmic exam, okay, now going back to the smellings test, I'm going to go ahead and have you cover up your right ear, and I'm going to say a number really quietly, and then you're going to go ahead and just repeat it for me.
33.
Okay, now let's cover your other ear, and I'm going to say it over here.
55.
Okay, perfect. So your hearing is good. Cranial nerve 8 is intact. And now we're going to go ahead and move on to the mouth and throat. So I'm going to inspect the oral cavity. Let me do this. Okay, so go ahead and open up. All right, oral mucosa is pink. All teeth are present. I can see the pharynx, looks good. Go ahead and say ah for me. Okay, I can see the uvula, it's midline, and the tonsils are about a grade 1. I'm gonna check your gag reflex and go a little deeper. Okay, perfect. Alrighty, so with that, pharynx was present, tonsils were about a grade 1, uvula was midline, gag reflex was present, so cranial nerve 9 and 10 are intact. Go ahead and stick your tongue out for me. Okay, it's good tongue perfusion and no lesions noted on the tongue either. Cranial nerve 12 is intact, and then let me have you go ahead and shrug your shoulders for me. Go ahead and shrug them. Okay, bring back down. Good. So good shoulder shrug. Cranial nerve 11 is intact. So now we're going to go ahead and move on to the neck and lymph nodes. So on visual inspection of the neck, the trachea is midline. I don't see any obvious deviation to the left or right side. So that looks good. And now we're going to go ahead and look at the, we're going to auscultate before we palpate anything. So I'm going to go ahead and have you take a deep breath in and out, and then hold that breath. So go ahead. Okay, hold that breath. Now I'm going to auscultate the other side. All right, no bruise noted on the carotid artery. So now we're going to go ahead and palpate. I'm going to locate your thyroid gland. Okay, go ahead and swallow for me. Okay, there it is. Now go ahead and look to the left. Okay, I'm stabilizing your thyroid, and I'm feeling with my right hand. I don't feel any goiter, any masses. Okay, looks good. Now let's turn to the right side. Stabilizing with my right hand and feeling with my left. No nodules, no masses, no goiter present. Okay, good. Now we're gonna check your lymph nodes. So we're gonna start with the occipital. Okay, occipital is good. Now we're gonna do the postauricular, preauricular. Okay, good. Tonsillary, submandibular, submental. Okay, we're gonna go back to the cervical, posterior cervical, anterior cervical, and then the supraclavicular. Okay. Do you have any tenderness in any of those lymph nodes?
No.
Okay, good. They felt all soft for me as well. All right. So now we're gonna go ahead and move on to the chest, the anterior thorax, and the lungs. Go ahead and remove your jacket for me. Okay, skin looks good. No obvious deformities there. No redness or swelling anywhere. No obvious discolorations. Chest is in good shape, symmetrical. It's good. We're going to go ahead and palpate across the ribs and the sternum. Do you have any tenderness when I do this?
No.
Any tenderness?
No.
Okay, any tenderness?
No.
Okay, good. Now we're going to look for tactile firmness. So go ahead and repeat after me every time I touch your chest. 99.
99.
Okay.
99.
Okay.
99. 99.
Okay.
99.
Alrighty.
99.
Okay, good. Normal tactile firmness. So I'm going to go ahead and auscultate now. And I'm going to auscultate in at least 8 fields. Good. Deep breath in. Okay. Right under here. Okay, right under here. Okay, lung sounds are nice and clear. No adventitious breath sounds. So now I'm going to go ahead and auscultate your heart. I'm going to start with the aortic valve, move on to the pulmonic, then Erb's point, and the tricuspid and the mitral valve. Okay, and I'm going to auscultate all of these with the bell and diaphragm. Okay, just breathe normally. Okay. Erb's point. Okay, tricuspid. Okay. All right. Okay. All right. I was able to auscultate the point of maximum impulse there. Now I'm going to go ahead and palpate it. Okay. Point of maximum impulse was able to be palpated in the fifth intercostal space, midclavicular line. So now we're going to go ahead and move on to the posterior side. So go ahead and just sit up a little bit for me at the end of your seat, a little bit. Okay, good. So on inspection, the skin looks clear. I don't see any obvious deformities of the skin, no suspicious moles or anything. And I'm going to go ahead and start with tactile fremitus. So go ahead and repeat 99 again every time I touch you.
99,
Mm-hmm.
99,
Good.
99,
Good.
99, 99, 99.
Okay, good tactile fremitus there. Now I'm going to go ahead and auscultate the posterior lung field, at least 8 locations. Go ahead and take deep breaths for me every time I'm listening. Okay, breath sounds are clear, no adventitious sounds. I'm going to do CVA tenderness as well. So I'm going to go ahead, well, before I do that, I'm going to percuss over all these fields too. Okay, no hyperresonance noted. I'm going to go ahead and palpate for CVA tenderness. I'm going to go ahead and strike my hands here. Let me know if you feel any tenderness. Okay, good. CVA tenderness was there. So now I'm going to go ahead and auscultate you one more time. And every time that I auscultate you, go ahead and say 99 as well.
99, 99, 99, 99, 99, 99, 99.
Okay, normal finding, just muffled sounds, which is expected. Okay, now from that, we're going to go ahead and let me have you move over here. And we're going to inspect your we're going to look for jugular venous distension. So let me have you sit up just a little bit more, and let me have you turn to the left. Okay, I can see good pulsation from the jugular vein. So let me go ahead and measure that at the point of maximum impulse. Okay, I'm gonna do that. All right, looks like it's about 2 to 3 centimeters, which is expected, so that's a good normal finding. All right, we're gonna move on to the abdomen. So on the abdomen, I'm looking at, go ahead and lay flat for me, and lift your throat just a little bit. Pull these down just a bit. Okay, so I'm looking at the abdomen. see good contour, it's flat, round, no visible pulsations, no hernias noted. I'm gonna auscultate before I percuss and palpate. So I'm gonna auscultate at least 4 quadrants, and I'm gonna also auscultate for any bruise over the aorta and renal arteries. Okay, no bruising in the aorta, on the renal either. Okay, now I'm going to go ahead and auscultate all 4 quadrants. Okay, good bowel sounds. Bowel sounds present. Bowel sounds present. Bowel sounds present. Okay, sounds good. So we're going to go ahead and percuss now. We're going to do at least 2 percussions per quadrant. Let me go ahead and do that. Okay. Okay. Good tympany noted. The only dullness was over the liver, but that's expected. So now we're going to go ahead and palpate. First, I'm going to do a light palpation, then I'm going to move on to the deeper palpation. Okay. Let me know if you feel any tenderness when I do this.
No. 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 No.
Okay. Now I'm going to go a little deeper. Okay. Any tenderness?
No.
Okay.
No.
All right.
No.
Okay.
No.
Okay. Good. No tenderness noted. So I'm going to go ahead and I'm going to try to palpate for the liver in the right coastal area. I'm not able to palpate the liver, but that's okay. That's kind of a normal finding. I was able to percuss it though. Okay. Good. All right, so the liver measures about 4 fingers width, which is expected. I'm going to try to go ahead and palpate the spleen. So I'm going to go ahead and press down and breathe in and out. In and out. Okay, I wasn't able to palpate the spleen, but that's okay. That's kind of expected as well. Same thing with the kidneys. That's hard to palpate. Sometimes it's not palpable, but usually the right one is. So I'm going to go ahead and just palpate down here. Wasn't able to palpate the right kidney. I'm still going to try the left. Left kidney is not palpable either, but that's okay. They're not always palpable. Okay, so let me go ahead and have you sit up for me now. Okay, now I'm going to go ahead and inspect your upper extremities. Color looks good, and temperature's good. No abnormalities, no redness or swelling. So now we're going to go ahead and go on to, we're going to check your sensation on your upper extremities. First, we're going to look at your nail beds. Let me see your nails. I'm assessing for clubbing. I don't see any clubbing. I'm going to check capillary refill, pressing down on all the nail beds. Okay, good capillary refill. And then now we're going to go ahead and brisk capillary refill. We're going to do the sensation now. So I'm going to go ahead, have you stick your arms out for me, and tell me if this is sharp or dull.
Sharp. 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 Sharp.
Okay, understood.
Dull. 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 Dull.
Okay, did that feel pretty equal on both sides?
Good.
Okay, good. Now I'm going to check for range of motion. So let me go ahead and have you stick your arm straight out. Okay, good. Now up. All right. Now bring it back behind you. Okay. Now let's do abduction. Stick them out like that. Okay. Abduction. Bring them in. Okay. Now bring those behind your back. All right. Now let's have you bring your elbows out. Now let's have you bring them out, bring them back in, bring them out again, internally rotate, externally rotate. Okay, now bring them back to the front. Let's have you point your fingers down. Okay, good wrist flexion, bring them up, good wrist flexion, and then bring them like that. Okay, good. I'm gonna look at your skin turgor as well. Okay, and now we're gonna go ahead and move on to the strength. So go ahead and bring your arms back out again. Pull against me. Okay, resist me. Push down, resist me. Okay, good. And then push up against me with your shoulders. Okay, good. Good strength. 5 out of 5. And we're gonna also check the pulses as well. So let me go ahead and do both your radial pulses. Okay, good. About 2 plus. Brachial. Okay, 2 plus as well. All right. Now we're just gonna move on to the reflexes. So I'm gonna test your reflexes in your biceps bilaterally. So right up there. Okay, good reflex. Okay, good. I'm gonna do the tricep now. Okay, let's bring it like right about there. Okay, perfect. Okay, good reflex in the tricep. Good reflex in the opposite tricep. Okay, now we're gonna do a brachioradialis. Okay, good reflex in brachioradialis. And good reflex there as well. Okay, so that's it with the upper extremities. Now we're going to go to the lower. In the lower extremities, color looks good. I don't see any redness or abnormalities of the skin. No suspicious moles or anything. So we're going to go ahead and palpate the pulses. So let me go ahead and palpate your popliteal pulse. Okay, good pulses there, about a 2 plus bilaterally. And your dorsalis pedis, 2 plus there as well. And then I'm gonna check your femoral. So just go back just a little bit. So check right in there. Okay, fell. Okay, equal bilaterally, about 2 plus as well. And now we're gonna go ahead and do the sensation on your legs as well. Tell me if this is dull or sharp.
Dull, 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 dull.
Okay.
Sharp, 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 sharp.
Okay, good. So good sensation there. Did it feel equal bilaterally as well?
Yeah.
All right. So now we're going to go ahead and move on to the range of motion. So go ahead and stick your legs out for me. Okay, now bring them back in. Okay, good. Now bring your feet up only, and now point them down. Okay, good. And then try to externally rotate them, internally rotate them. Beautiful. Okay, so now we're going to go ahead and test the strength there as well. So push against my hands. Okay, pull down. Good. Now, same thing with, now push against my hands. Okay, pull. All right. And then now with the ankles, go ahead and push down. All right, pull up. Good. Push down. Okay, pull up. All right, good strength. 5 out of 5 on the lower extremities as well. We just need to do the reflexes now. Okay, excuse me. So we're going to test the popliteal on both sides. So go ahead and have your leg hang. Good reflex there. Good left popliteal. Okay, let's test the Achilles. Okay, good reflex in the left Achilles. Good reflex in the right Achilles. And then we're going to do Bovinski's. So go ahead and have your feet out for me, please. I'm just going to kind of run my fingers across. Okay, no fanning of the feet, which is good. Negative Bovinski test. Now go ahead and stand up and turn around for me. Okay, I'm inspecting the spine, and I don't see any obvious signs of scoliosis, lordosis, or anything, go ahead and lift your arms up for me. Okay, good scapulary symmetry as well. Go ahead and bring it back down. So now let's test your gait. So go ahead and just walk to the end of the rug for me and then come back. Okay, good. Now walk to the end of the rug, heel to toe for me, and then come back. All right, good balance. Okay, now go ahead and put your feet together and your hands to your side, and then close your eyes for me. Okay. All right, good Romberg test. I didn't see any swaying or anything. Okay, go ahead and take a seat. Okay, do you have any questions or anything?
No.
Anything? Okay, good. Well, it was nice meeting you today.
Thank you.
All right, have a good one.